Hello, and thank you for the opportunity to join you today. I bring greetings to the California Medical Association on behalf of everyone at the AMA. Now, I want to begin by recognizing Dr. Peter Breton for his outstanding leadership as CMA president. Thank you for all you've done to support physicians at this most difficult time. But as physicians, we understand better than anyone how a health emergency can sometimes disrupt even the most carefully thought out plans. So I give you my very best wishes for the year ahead. And of course, to my colleagues and friends on the AMA board, trustees Dr. Jack Resnick and Dr. David Azus, as well as State Senator Dr. Richard Pan, who serves on the American Academy of Pediatrics delegation to the AMA, I thank all of you for your leadership and your voice in organized medicine. This year has tested us in ways few could have imagined. From the COVID pandemic to the wildfires that have swept through California and much of the West, time and again, physicians, physicians' assistants, nurses, and our entire healthcare community have risen to the challenge of this moment. Your tireless work in the face of these extraordinary events has been nothing short of heroic. Some have died. Many have fallen ill. All have worked extremely long hours under intense pressure and in sometimes dangerous conditions. We still have a lot of work ahead of us to defeat COVID-19, but I want to offer my most sincere and heartfelt thank you for all that you've done and for all that you will continue to do on behalf of your patients. After more than 30 years in a small private practice, I'm a passionate defender of the independent physician. And, like the AMA, I'm focused on removing those obstacles that have come between us and our patients. Insurer and government mandates, decreasing payments and increasing demands, burnout and physician suicide. And the coronavirus pandemic has made all of these problems more acute. Now, like CMA, our AMA is a recognized leader in medicine. But with that platform comes a responsibility to make sure public health and policy decisions are rooted in science and evidence, not ideology. We have a responsibility to do everything we can to give physicians the support and the resources they need to navigate this difficult time. That's why AMA has called on state and federal policymakers and private payers to ease unnecessary administrative burdens, such as prior authorization, audits, data requests, and quality reporting, and why we successfully pushed CMS to not penalize us for failing to complete MIPS reporting last spring. To date, 14 states have eased administrative barriers, such as prior auth and step therapy for COVID-19 care, and dozens of states have removed prior authorization for testing. The AMA continues to push the administration for more resources for COVID-19 testing and protective equipment to minimize your personal risk of exposure. PPE shortages continue to be a problem for individual physician practices in many states. A recent AMA survey found that more than 1/3 of physicians had a very or extremely difficult time acquiring PPE. The AMA understands that the administration has used the Defense Production Act on a number of occasions to alleviate these shortages, but there continues to be a tremendous need for physicians in office settings. The AMA will continue to push FEMA and the administration to ensure physicians have the tools and resources they need to protect themselves and their loved ones. Earlier this year, AMA worked in partnership to secure more than $175 billion to support frontline healthcare personnel in the Federal CARES Act, as well as millions in loans and additional funding to help independent physician practices overcome the financial hardships brought on by this pandemic. We're wrapping up a national survey of physician practices that will give us a better understanding of the financial impact of this pandemic on practice sustainability. Results from that survey will be made available soon. The AMA has also pushed for widespread adoption and expansion of telehealth and supported congressional action to advance payment parity of remote care. We created an AMA telemedicine implementation playbook to accelerate adoption. The playbook outlines a clear and efficient path to rapid, scaled implementation of audio and visual visits and is available for free on our website. We continue to fight for greater liability protections for physicians who, in many cases because of social distancing guidelines, have had to significantly change how they treat patients for non-COVID care. In particular, we are pushing for the Coronavirus Provider Protection Act, introduced by Representatives Lou Correa of California and Dr. Phil Rowe of Tennessee, that would provide targeted liability protections to healthcare providers who had to change how care was delivered because of ever-evolving public health recommendations in this pandemic. So far, 19 states have enacted statutes that provide immunity protections for physicians during this pandemic, and we continue to urge federal action on this issue. As the pandemic evolves, the AMA continues to fight against inappropriate scope expansions to non-physicians. Recently, AMA fought alongside CMA by advocating strongly against AB 890, which allowed nurse practitioners to work without physician supervision. Unfortunately, we were not successful in stopping the bill from passing, but this fight is not over. Our state advocacy team and Office of General Counsel is working to address this issue at the regulatory level and, if needed, in the courts. With a vaccine on the horizon, we're pushing the FDA to provide more clarity to the physician community about the steps being taken for authorization and licensure. Physicians and patients need to feel confident in the safety and efficacy of the COVID-19 vaccine candidates, and the FDA must start now to provide information, education, and transparency around their process, including how they'll review vaccine candidates and the clinical endpoints they hope to achieve. Transparency is crucial to ensure vaccine literacy and acceptance amongst all demographics, and particularly to ensure vaccine education and accepted among communities hardest hit by COVID-19, such as Black, Latino, and Indigenous communities. Finally, I want to applaud the new state mental health reform law, Senate Bill 855, signed by Governor Newsom, which will go into effect in January. This law protects those with mental health and substance use disorders by requiring insurers to cover their medically necessary treatments. We believe this law sets a precedent for other states to follow and will improve treatment and save the lives of so many. So before I close, I just want to reiterate how incredible it is to have organizations like the California Medical Association standing beside the AMA and physicians in this challenging time. We applaud your work and deeply appreciate your partnership on these and so many other issues. We've not yet reached the end of this crisis, but physicians know we have their backs, and that we're always going to be out there fighting for them and for our patients. Thank you.